My name's Julie Mead and I'm a stroke specialist nurse working in the community stroke team. Every patient who's had a stroke gets referred to the community stroke team, and covering North Tees and Hartlepool Hospital we have a community stroke team in Stockton, a community stroke team in Hartlepool, and there's also one in Peterlee, so we refer the patients to the appropriate team. The community stroke team predominantly sees all patients within their own home because we feel that is a better environment to be able to achieve optimum recovery from the stroke, and also it allows relatives to be part of the recovery as well, and the treatment that's provided. The role of the nurse in the community stroke team is important because predominantly we do perform the 6-month stroke reviews, and it's important to continue with education for the patient in order that they're able to know what the risks are and know how to try and stay within the guidelines, so they can reach the optimum potential following the stroke. So looking at preventing further strokes, we look at risk factors, and from when a patient is either seen in the hospital clinics or seen in the ward. So whenever they're diagnosed with a stroke, the secondary prevention starts there. So the doctors and the therapists and the nursing staff will look in the acute setting, and will look at doing blood tests, looking particularly if anybody's got diabetes. We're looking for cholesterol, because diabetes and cholesterol are two of the risk factors for stroke. Blood pressure gets checked regularly because blood pressure again is an important aspect of stroke care, and it's important that we keep our blood pressure controlled. We've got medical risk factors and lifestyle risk factors. So the medical risk factors are like what I said earlier with the diabetes, the high cholesterol. There's also atrial fibrillation and any heart problems. Lifestyle risk factors look at smoking, alcohol, diet, exercise. So it's important that we look at all those risk factors and try and help the patient to be able to put anything in place that's needed in order to try and stay within those guidelines.